event on this topic with local leaders after the spa shootings in Atlanta to help them feel safe and supported. Sharing their stories is more important than ever, and we'll continue to speak out against discrimination and hate speech. On April 27th, of course, Montgomery County implemented the benchmarks to allow for further phased reopenings tied to our COVID-19 vaccination rates through a new regulation, with nearly 53% of the county's population vaccinated with at least one dose. Now gathering limits have increased to 50 people outdoors and 50 people indoors and 100 people outdoors. Businesses and theaters have moved from 25 to 50% capacity, and 50 participants are allowed for indoor sports and 100 for outdoor sports. Once 60% of our residents are vaccinated, we'll eliminate outdoor gathering limits and increase indoor gathering limits to 250 people and allow residents to operate at 75% capacity. Also, we're very excited that residents will now be able to schedule their own appointments online at the Germantown mass vaccination site. They'll also be able to walk in for a vaccination at this site if appointments are not filled in that day for that day at the Germantown site. And in the next few weeks, the county will be transitioning away from making our residents pre-register and instead enabling residents to schedule appointments themselves. And I know both doctors will probably elaborate on that. And then finally, I wanted to let you know that the county DOT on last Thursday sent a letter to the Maryland members of the WMATA board, Mr. Greg Slater, Secretary Slater, and Mr. Michael Goldman, outlining the county's priorities for the capital improvement program and the FY22 operating budget for WMATA. You all will recall that just a few months ago, WMATA was facing tremendous deficits and planning to close up to 22 stations and to lay off over 2,000 workers. But thanks to the American Rescue Plan, WMATA will now receive approximately $1 billion, which will allow them to maintain Metro bus and rail services for the full year, avoid the proposed closures and the proposed turnbacks at Grosvenor and Silver Spring, revise phase 2 of the Silver Line, which means our residents could be riding the Metro to Dulles Airport as early as January 2022, and open the new Potomac Yard station in the fourth quarter of 2022 as well. They'll keep Metro Rail operating at 80% of pre-COVID levels and keep Metro Bus operating at 85% of pre-COVID levels. In our letter, we outlined the following priorities: retaining full service to all Red Line stations without the turnbacks at Silver Spring and Grosvenor, funding capital improvements like the Forest Glen George Avenue underpass, many pedestrian bike access improvements at the Rockville, White Flint, and NIH Medical Center stations, and many enhancements at the Shady Grove station as well, and adding key Metro extra routes like the K9 on New Hampshire Avenue and a new one on Veers Mill Road. WMATA has suffered a great loss in ridership, particularly rail ridership in FY21. They need to refocus on rebuilding ridership in FY22 by using this generous federal funding to improve their rider experience and expand access in ways that address shifting transit demands, maintaining the service levels for our essential workers, but improving the service to attract choice riders and give them incentives to leave their cars at home. With that, let me pass it over to Vice President Albornoz.
Thank you, Mr. President. Just appreciate your continued leadership. So I'll just start out on a personal note. I received my second vaccination on Friday at the Six Flags location in Prince George's County, one of the state mass vaccination sites, and had a terrific experience. And I just want to note that I had no side effects. And I know this has impacted people differently, but we're hearing among the reasons why some people are potentially reluctant to get the second shot is the stories they've heard from friends or neighbors or family members that may have had some type of a reaction short term. I did not have one. And even if I had, I still would have strongly encouraged all residents to secure their second vaccination and obviously register for the first as well. And there have been recent meetings to discuss a coordinated effort to ensure that our young people are accessing the vaccination at a rate that we need them to, particularly in our community, to hit the benchmarks that we'd like to hit in order to be able to reopen safely. And I'm sure Dr. Kroll and Dr. Stoddard are here to elaborate on that, but there will be a lot more emphasis in the coming weeks on engaging our youth in particular, as well as other populations that have not, for whatever reason, or that have been for whatever reason, reluctant to get the vaccination. My other update this morning, Mr. Council President, is last Wednesday, the County Council hosted a joint committee session of our Education and Culture and HHS committee to receive an update on the current situation involving the most recent round of unaccompanied minors entering the US and migrating to different parts of our country, including right here in Montgomery County. And we received an excellent update regarding an interagency effort between the Department of Health and Human Services, Montgomery County Public Schools, and a number of other partners in the community to create a strong system of care to have a coordinated effort to ensure that we provide as much support as we can to these children and youth in need who are fleeing just really dramatic circumstances and challenges in their countries of origin. And I want to give Dr. Kroll a lot of credit for working on identifying both Ms. Gillian Hubner as well as Dr. Maria Navarro, who have been tasked with leading this interagency effort to ensure that the infrastructure is in place here in Montgomery County to be able to provide these children and youth with the support that they need and that we can provide. I also want to very much acknowledge Dr. Jack Smith and Montgomery County Public Schools, who have clearly taken the lessons learned from the most recent wave of unaccompanied minors and have applied that moving forward. And I'll just mention a few things that we learned in this briefing, which is that the United States is expecting a 20-year high in the number of unaccompanied migrant children and youth seeking asylum here in the United States. And as of January, there have been approximately 34,000 unaccompanied children that have been processed at the border and either have been transported to sponsors in respective local jurisdictions or are waiting to be transferred. And the majority of the unaccompanied children thus far, 48% come from Guatemala, 25% from Honduras, and 14% from El Salvador. 72% of unaccompanied minors are older than 14 years of age, and 68% are boys. And the majority of unaccompanied of children are seeking to unify with family members in the United States. The District, Maryland, and Virginia is among the top 10 receiving areas in the entire country because of the large percentage of Central Americans that reside and work and live and contribute to our community in so many different ways here in Montgomery County and across the DMV. And to date, we have been informed by federal agencies that at least 104 children have been released to sponsors here in Montgomery County, but we suspect, and they suspect, that number is actually larger because the information is approximately 2 months old. And so that number could be higher. And we heard from officials on Wednesday that we expect as many as 3,000 children and youth to be released here in the care of sponsors in the DMV. And also note that those are children and youth that have officially gone through the asylum seeking process, but there are students, children and youth that make it across the border without formally going through the process. And so that number could be higher as well. It's also important to note that through this interagency effort, we have been able to stand up a number of support services that are coordinated and that have taken the lessons learned from the waves that we received most recently 5 or 6 years ago. And we also received a briefing from the representatives from the International Mayan League that in particular, the children and youth coming from Guatemala are of indigenous, a significant percentage are of indigenous backgrounds. And in some instances within Mayan culture, there are more than 30 dialects of indigenous languages spoken among the children and youth that are coming to the United States. The numbers are, we don't know exactly because this information is not tracked at the level it should be at the federal level. And so Montgomery County is looking at taking steps moving forward to better track this information so that we can be in the best possible position to provide support for these children and youth. I'll just end by summarizing that here, we don't just believe it's a moral responsibility for us to support these children and youth who are fleeing violence, who are fleeing climate disaster, who are fleeing just extreme poverty and extreme economic challenges. But they're coming in large part to sponsors who are here, county residents who are contributing economically and contributing so many in so many ways to our community. They are our neighbors. They are residents and constituents and who are just trying to reunify with their children or with their family members. And so Montgomery County stands ready, and we will be coordinating our efforts regionally with representatives from Virginia, as well as the District of Columbia and neighboring jurisdictions to ensure that we have a holistic response to supporting these children and youth. And the council will be receiving another update later this summer before we go on our summer recess in August, where we will receive an update on where the numbers stand. And I also lastly want to mention that we have forged a strong partnership and alliance with the federal agencies who we are in communication with and will be working closely with to ensure as seamless a transition as possible while these children and youth go through the asylum seeking process and until they do, providing as much support as we can. So with that, Mr. Council President, I yield back to you.
Thanks for all your leadership on that. Dr. Kroll?
So good afternoon, Councilmember Albornoz and Council President Albornoz, Council President Hucker and Council Vice President Albornoz. Thank you all and to everyone else. So I'm going to start back at the top of this and go through just some conversation on some updates on COVID-19 and then end going where Council Vice President Albornoz did on unaccompanied minors. So just then very briefly, we had, in terms of rates and data for the county, 42 new cases over the weekend. Our test positivity is sitting at a low of 2.2%, and our rate is 6.6. So overall, going in the right direction. In terms of vaccination numbers, I want to note that 84% of persons 65 and older have been fully vaccinated in Montgomery County. And that's compared to a statewide number that is approximately 75% of persons 65 and older. We have, when we look at Marylanders who are 16 and over, right now we are looking at about 1.9 million Marylanders who've been fully vaccinated, which is up about 11,400 from yesterday. Overall, we still have about that's a total of about 39%, 40% of the cohort, with 39% went out yesterday. So we're about 40%. For Montgomery County, we have 397,000 fully vaccinated residents who are 16 and over. That's 47% of county residents. Now, you all will hear a number periodically thrown out that we have 564,000 or some number like that that have at least one dose, and 67%. And we've been talking about that a lot because it's an important number. But the message I want to share with folks is that is how many people have reached the halfway point in the marathon, not how many people have been fully vaccinated. My worry and my concern as a psychologist is that when I hear those numbers, people hear 67% have gotten at least one dose, and the at least one dose fades off, and people may get a little bit comfortable and more comfortable than they should around this. Caution and CDC adherence to CDC guidelines and local guidelines around mask wearing and is important. I want to ask people to continue to periodically get themselves tested if they feel they've been exposed, but to maintain some caution and to come out and get vaccinated. In terms of updates on our process for vaccination, I think Council President Hucker noted that we're changing the process at Germantown and going to direct scheduling so that people can go online, and the online portal has been adjusted to reflect that. So when you click on now, you'll find yourself directly with direct access to a time of date up at the Germantown mass vaccination site. And so you can go through the process and schedule that way now going forward. And there will be some walk-ins at the end of the day. We expect to go to that framework for other county sites in the very near future. We've also added to the process a partnership with FEMA. They have made available vaccinators and doses in small dose batches, 100 a day or in that neighborhood, at movable locations, so we can move around to spots that where we are under vaccinating in the county, where people are not fully taking advantage of vaccination opportunities. So, and inviting folks to come to those sites. This week, they're going to be at the Civic Center, and they're going to help us by doing evening hours. They will be there Thursday, Friday, Saturday, and Sunday, with evening hours planned from 4 to 8 p.m. on Thursday and Friday. And on Saturday and Sunday, we're working on some afternoon hours. You can expect a notice from us a little later in the week about the afternoon hours. We're working primarily through advanced scheduling of appointments through a pre-registration process. But the last hour of each of those days we will be taking walk-ups, so that if there's some fall off in the scheduling and there's some additional doses that are available, we'll be taking walk-ups. So hopefully folks will take advantage of that, and we'll especially being at the Civic Center over the weekend, we'll take advantage of that and just drop in as you finish up with the farmers market, just drop in and get vaccinated. In terms of equity, we are still seeing some disparities by race and ethnicity across the state, with Black and Latinx communities lagging behind. Locally here in the county, the 16 and over gap between our white residents and the Latinx community has closed to about 10%, but it is still higher for the Black community at about 17%. So we are mindful of the need to continue to encourage and inform those communities about the need for vaccination and try to do what we can to make it available to folks. As we wind down the use of pre-registration as a means of ensuring some equitable distribution of access to vaccinations, we are still mindful that there is a digital divide and that access is still a challenge for some folks in some communities. Standing up regionalized processes, regionalized vaccination sites is going to make it easier for folks to access. And the more of those sites we have and the more vaccine we have available, the easier it becomes for folks to go online and use that approach to schedule and to maintain some sense of equity in that. But because digital divide is still an issue, we are looking and will continue to do direct outreach with our community partners, the Minority Health Initiatives, and the Office of Community Partnership, targeting sites and our efforts in those communities to those communities where we know, where the data continues to tell us we are under vaccinating or not getting vaccinated in numbers that we are in other parts of the county. We are shifting. Our outreach efforts have been focused primarily on pre-registration and testing up to this point. Our community partners are now shifting more to scheduling folks and helping folks get scheduled for vaccination rather than pre-registered. We will begin to wind down our use of pre-registration within the coming weeks or so, and we will make sure that anyone who is pre-registered up to that point, we will pull and get them into a vaccination site as quickly as we possibly can. Working with the communications team, we are now shifting our messaging focus to those folks who are 16 and over in that younger age range, to make sure that they are aware of the need to get vaccinated, to have conversations with them about any issues or concerns they have them sitting on the fence or delaying, and to try to make it clear that we need them to be part of this process and part of the solution of getting vaccinated. There's of course, a sense that they're younger and that they may be not as vulnerable to this, but there is still a possibility of passing on and contributing to the spread to family members and older folks and others who may be more vulnerable. So we want to make sure that they get that message. So to finish up with and follow up on Council Vice President Albornoz's message to you all about unaccompanied minors and children fleeing violence, I think he's done an excellent job of laying out all the details around this. We are in partnership with the school system, Health and Human Services, and its various services, as well as community partners and providers, and the federal government and the Office of Refugee Resettlement and Federal Health and Human Services, to make sure that we have a strong team in place to deal with what we expect to be a very high number of young people coming into the county. Councilmember Albornoz noted that there were 104 that we know of. we expect that number. We do expect that number to go higher, and those are the young adults, the young people, children, and young people that are detained at the border and then processed through Health and Human Services and ending up here. We still do not have a good sense of how many young people have managed to elude the border patrols and have are on their way to Montgomery County. So we expect those numbers to be high this year. Our work is, and the team that the Council Vice President Albornoz pointed out is focused on advanced connections to connecting and support and navigation support to help young folks get what they need as soon as they get here, to get them stable and safe, to help their reunification with families, and to get them acclimated to life in Montgomery County, and to help them get ready for their academic future in the fall. And then lastly, to deal with what we know are going to be the trauma issues that many of these young folks have suffered, both before they made the decision to leave their homes, but also all along that journey to Montgomery County. We will also, as part of this process, we're including health assessments for folks, including COVID-19 testing and vaccination as needed. So I'm going to stop there and turn it back over to Council President Hucker for any follow-up.
Just turning the floor over to Dr. Stoddard. Thank you so much, Dr. Kroll.
Yeah, I'll be very brief. For the mass vaccination site, Council President Hucker and also Dr. Kroll have already laid out exactly what you're likely to see, but just for everyone's knowledge, we did receive approximately 3,600 doses of Pfizer vaccine for the site this week, about 2,700 doses of Moderna vaccine for the week. And so what you can already see on the county's website is there are actually direct open appointment scheduling for Tuesday, Wednesday, and Thursday of this week with Pfizer. You can go on right now to our website and make an appointment for any time you want to for those next 3 days. And then we will offer walk-up opportunities to supplement whatever is left over from those appointments. There's about 1,200 appointments a day. I did want to talk briefly about, we got a bunch of questions about the face covering mandate, and I wanted to just give a quick opening, and we can certainly take questions on this issue. So as the Board of Health Regulations states, the county follows the CDC or Maryland Department of Health, whichever is stricter. In this case, the Centers for Disease Control guidance is a bit more strict than the requirements of the Maryland Department of Health. So if you look at the graphic on the Centers for Disease Control website, any place that you see someone wearing a mask as part of the graphic, the county would expect that you too would be wearing a mask. And so if you're unvaccinated in an outdoor dining setting, or if you're unvaccinated in a small but mixed gathering setting, you should be wearing a mask. If you are fully vaccinated, you are not required to wear a mask in an outdoor dining setting, nor are you required to wear one in a small group gathering. Outdoors, in large gatherings of unknown or mixed vaccination status, both vaccinated and unvaccinated people per the CDC guidelines are expected to wear masks to keep everyone safe. Now, just because there are certain environments like outdoor dining, for example, where you're not required as a vaccinated person to wear a mask, you may still feel more comfortable, in which case you are certainly, we would encourage you, if you have any concerns about the number of people who are around you and you're not certain about their vaccination status, we continue to encourage you to wear a face covering just for your own peace of mind. You've gotten this far being safe. We're near the end point. So we would encourage you to continue to do so where you think is appropriate. But if you feel comfortable out walking on a trail in a small group gathering with friends and family who are also vaccinated, or even in an outdoor setting where you're not regularly or routinely interacting with a large number of people for a long period of time, you won't be required to wear a face covering if you're vaccinated. So, and finally, we do not do we'll go out and look at businesses, making sure that they're operating correctly. We're not going to be checking for people's cards. If businesses want to do that, they can do that. There's nothing legally precluding them from doing that. We're not going to require that they do it. Check for cards, or we're not going to be checking for cards as the county enforcement system. We follow largely a complaint-based system. So if we do find a large group gathering that we do receive a complaint about, and come out and find a bunch of people gathered in a place without face coverings, we could issue citations in that case. It does not often happen. It hasn't happened in months. And so generally speaking, the reason why Montgomery County's numbers are lower is because people have been largely adhering to the guidelines, and we haven't had to do as much, really strict enforcement. And so we're going to follow the CDC guidelines and you know, hope that our residents will as well, and not have to do a whole lot of enforcement to you know, try and further coerce people into doing what they've already been doing, which is largely the right thing. So I'll stop there.
Thanks so much, Dr. Stoddard. Ms. Kennedy, it's all yours.
Okie doke. We have a few questions. If there are any reporters who have questions, please let us know in the chat. And we will momentarily be posting a graphic that outlines the county guidance on the mask wearing that for you reporters to take if you need it. So we'll be appearing in the chat here shortly. Our first question today comes from Dominique from WAMU. Dominique?
Hi, thank you so much. The question is for Council Vice President Albornoz. I was curious to know, I did get to listen to the briefing last week about unaccompanied minors, and WAMU, our reporter Kavita Cardoso did a bunch of reporting on unaccompanied minors in Prince George's County, and it does seem like the data shows that there are more unaccompanied minors in Prince George's County. I'm sort of wondering, have you reached out to Prince George's County Council or anyone there to sort of look at ways to work together on this, and especially with the disproportionate impact this also has on the Mayan population, as I heard last week, that there's essentially no data showing who the Mayan population is coming in, and that, you know, they don't actually speak Spanish. So that'd also be helpful.
Yeah, so I'm happy to report that this interagency group has reached out to our neighboring partners, both in Prince George's and the District of Columbia and Northern Virginia. And a regional alliance was also formed after the wave that we experienced several years ago. And so many of those relationships remain very strong. And there's an acknowledgement that we must work across jurisdictions in order to provide as much support as we can for these children and youth. And as a follow-up to our discussion on Wednesday, I will be reaching out and working with the council president on our colleagues from the council in Prince George's County. And my good friend, Councilmember Denny Taveras, has been a leader on this issue for a number of years to see what more we can do from a policy standpoint to further align with the really impressive coordination of direct services and programs that exist as well. Dr. Cole, did you want to have anything you wanted to add to that?
No, just to underscore, I think that's the numbers are correct, that we are seeing. The early reports do suggest more immigrants in Prince George's than in the county at present. There is an effort recognizing that there are going to be some linguistic challenges in the number of Mayan dialects and communities. We will be partnering with the Mayan alliance that we heard from last week to try to find ways to make sure that we have the capacity to engage people in their language, in their language of origin, so that it will to smooth that process as much as we can for folks as they come to as they reach our borders.
Thank you. And then I think my next question is for either Vice President Albornoz or President Hucker. I'm curious, there was a request put in by Councilman Hans Reamer to the county executive, and the request essentially was that he would like to reopen the Keith Warren case. We don't really know what the murder of Keith Warren that was deemed a suicide. I was wondering, have you heard anything from the county's executive office about this? Any comment on that?
I personally haven't heard anything about it since I saw the news article now.
Thank you.
Mm-hmm.
Okay, our next question today comes from Randy Bass from WDVM. Randy?
Good morning. Thanks for having me on the briefing. Appreciate you all taking the time to chat with us this morning. I wanted to ask about the Johnson & Johnson walk-ups being offered in Germantown today. Why start the walk-ups now with J&J? Was there a lack of interest or hesitancy, I guess, surrounding the vaccine? Was there another reason why they're starting the Johnson & Johnson walk-ups? My understanding is that there were a little bit over 1,000 leftover doses from before the pause. Is the county just trying to use those up?
So as I believe we mentioned last week, so we're sitting right now on about 15 to 20,000 still people in our pre-registration system. We have no people left from the state pre-registration system. If you remember back in the beginning of this, The allocation for the site was around, the first week was like 5,850. 2,100 appointments were going to come from the county's pre-registration list, and the remainder were going to come from the state pre-registration list. Because this week, the state has ended its pre-registration process, we've moved to that open scheduling for this week at the site to compensate for the fact that we don't have a pre-registration list for the statewide list anymore. So Johnson & Johnson was what we had left over from previous. We actually utilized all of last week's allocation. We have not received our next week allocation, won't until later today. So we have the Johnson & Johnson, that's all we have right now until we get delivery later today. And so we will do the same thing with Pfizer and Moderna later in the week. So it wasn't a selection around Johnson & Johnson because people weren't interested. We have Pfizer tomorrow through at least Thursday, perhaps into Friday, and then we have Moderna thereafter. It was just what we had available to us at the time that moved us into that. We ran out of names whether we wanted to use Pfizer, Moderna, or Johnson & Johnson this week, and so that's what drove us to move to that point. The county sites still, again, have that 15 to 20,000 pre-registration list. All of those people are going to likely receive an invite this week, and so we similarly will be doing a similar structure for the county sites moving into next week because those are what's using our pre-registration list.
Thank you for clarifying that, Dr. Stoddard. I appreciate that. And just to clarify something that was also said earlier, is it starting today or starting tomorrow or starting on another date that anyone can show up during the last hour of vaccinations at the site at MC and in hopes of getting a vaccine? Is that what I heard?
So today it's 10 a.m. to 2 p.m. We're going to vary the hours, likely both throughout this week, but also into the future. We're likely to do evening times, weekend times as well for the walk-up opportunities. Today it's 10 a.m. to 2 p.m. We'll evaluate later today how many appointments there have been filled with the Pfizer doses for tomorrow, Wednesday, and Thursday, and make a judgment about when exactly the walk-up hours for those sites will be. I believe what you're referring to is what Dr. Kroll said is that some of these FEMA opportunities, and Dr. Kroll, I'll turn it over to you for that.
Sure. To repeat, FEMA will be vaccinating with us at the Civic Center this week, Thursday through Sunday. Thursday and Friday hours will be from 4 p.m. to 8 p.m. And Saturday and Sunday hours will be 1:30 in the afternoon. We're still working on the precise start time for that. But the last hour of each of those days will be open for walk-ups, so that any unused doses that we might have will be available to folks who want to just come up at that point.
Great. And at those FEMA sites, you said they're mobile, so they're able to move around, which is great. Are people able to pre-register for a slot at one of those FEMA vaccination sites, or is the county targeting particular individuals for those appointments?
Well, right now for this week, they can certainly pre-register, and we will try to get them scheduled into those sites. But we're doing a lot of outreach to try to reach populations that have had some difficulty getting to the scheduling, in part because of time of day. So pushing this into the evening gives us some flexibility, and we're hoping that we can get more folks to schedule, to sign up.
Thank you very much.
Thank you, Randy. Our next question is from Rebecca Tan at the Washington Post. Rebecca.
Thank you so much. Dr. Kroll, I just wanted to clarify something. You said on the issue of unaccompanied minors, the county is collaborating with the Mayan Alliance. Was that a Mayan Council? I just didn't catch the name.
It's the International Mayan League, which is a national organization, but happens to have representatives that live locally.
Got it. And you're collaborating with them to get translators. Is that right?
Well, they've announced they have a group of folks that have translation capacity. So that would be minimally one of the things that we would do with them. We'll also be consulting with them about the appropriate ways of interacting with folks in the community to make sure we're doing things in a way that not only doesn't culturally offend folks, but also takes into consideration the unique circumstances of the Mayan peoples, both as indigenous peoples of the community and the things that they've suffered before they got here. As well as their experience during the journey here.
Got it. So Dr. Stoddard, is there any evidence, I ask this question every week, I'm sorry, but is there any evidence yet of vaccine demand dropping off in any specific demographic groups?
Not any specific demographic groups. I mean, you could look at the county's vaccine dashboard. You can see that last week we did less first doses than we did the week before. So we are seeing a drop off in demand, not necessarily. I mean, we got all of our county doses out last week, so we're seeing a drop off demand in other places, meaning people are accessing less of the pharmacies, less of the hospitals, less of the mass vaccination sites, and that's why the state is moving to this open scheduling system. It's not in a particular demographic that we can discern yet that there's this increasing level of hesitancy, as we often call it. And I think Dr. Kroll was getting to this a little bit. What we're concerned about is the loss of of a sense of urgency in some portions of the population too, where we've been saying how well we're doing, and we are doing well, but doing well and finishing the job are two very different things. Just because 55% of the population has received a first dose doesn't mean we're close to achieving any sort of protective immunity or herd immunity. And so we still need people to come in and get vaccinated. Obviously, getting vaccinated will help us get back to a greater sense of normalcy. It'll protect people who haven't been able to vaccinate. It'll protect people who have been able to vaccinate, but you can have breakthrough cases. Having more people, having a greater web of people vaccinated will help everyone. And so we're still trying to, increase access by doing things like walk-offs, by doing on-demand scheduling, by doing these off-hour, multi-hour, evening, weekend, different locations, different kinds of venues closer to people, talking to people, different populations differently. And so we're trying to do a lot of things across the board to really drive into to get people to understand that we still need them coming to get vaccinated. I don't think we fully reached that. We're trying to convince people to get vaccinated yet. We're trying to reduce the barriers to vaccination so that we can increase the numbers moving forward.
Got it. And another question for you. Are there any trends in the case rates and infection rates that you're able to share right now? I know Montgomery County just reported another death. Who is still getting the vaccine? How are they getting it? And sort of connected, is there any evidence that you know of in Montgomery County of the Indian variant of the coronavirus emerging?
I don't. I saw a graphic this morning that showed some of the variants. Largely the variants in Montgomery County are the B117 is the most prevalent variant. We have seen an increase in the 1526, which is the New York variant. There are 2 New York variants. We're seeing a little bit of an uptick in that, but we're talking under 10%. The vast majority of the tested samples in Montgomery County are the quote unquote UK variant, the B117. I did not see on that graphic any sign that there has been an increase in the variant from the quote unquote double variant, which candidly is a terrible term for it. You shouldn't use it if you can avoid it. I think it's become into culture, but it's got multiple mutations. It just has some features of both the P1 variant, which is the Brazilian variant, and the UK variant that do make it potentially. We haven't seen. I can't report that we've seen any increase in the quote unquote Indian variant.
Who's still getting the who's still getting the virus? Can you say?
Contact tracing data says people most at risk of getting the virus are people who still end up having to work because of their livelihood, have to work outside the household. That's been the #1 activity identified consistently throughout. There has been, as we've increased indoor dining, there's been a slight uptick there, and there's been a pretty consistent any of the retail environments. So there's no change in the contact tracing. Even as the numbers have come down, the contact tracing hasn't shifted in such a way that says, this thing over here is still driving transmission at this point. We have not seen any major upticks in anything. It's been the consistently high things and remain the consistently high things in the contact tracing data. I don't believe it's travel. I think it's just there's low levels of infection occurring throughout the community. You see higher levels of infections in the communities where you have a preponderance of people who have to leave their house to work. And so if you tracked where the virus was, that's typically where you would see the most number of cases.
Thank you.
Thanks, Rebecca. Our next questions will come from Kate Ryan from WTOP. Kate?
Thank you very much. I wanted to get back to unaccompanied minors, and Councilmember Albornoz, you said, we're looking at lessons learned from previous experience, and that experience goes back more than a decade. What documentation do we have of how well or not we did? And what are we going to do differently? I know the demographics are different, as we've said, a lot more Indigenous folks apparently. And of the 104, are most of those elementary, middle, or young adults? We often see a lot of an influx of young adults, teenagers. What can you tell us on, I know I'm hitting you with a lot, but I'm curious.
No, good questions, Kate. Thank you. So the county formed a number of years ago a children fleeing violence work group. And that work group was made up both of county representatives, community-based organizations, but also members of the community. And that group never stopped meeting, to their credit. And so they were able to mobilize quickly a number of the programs and services, and the interconnectivity through case management here is critical because these students, as Dr. Kroll mentioned, are experiencing just off the charts levels of trauma, which require a great deal of intervention from a number of different partners. And having that be coordinated puts everyone in the best position to holistically support the needs of these children. And there have been formal reports and notes taken, and this work group, as I said, has continued to meet and will serve as a continued and trusted leader. And now we've added additional resources on top of it through formal coordination at the county level, which I think is really going to have a significant impact. And while we know there will be needs that we're not going to be able to fully address, we believe this will put us in the best position to address as many of those needs as possible.
So, Councilmember Albornoz, if I may, I just would add, just in terms of the things that we are doing now that were brought into focus through the work of the Children Fleeing Violence Work Group the last time. One is this advanced work of pulling the team together now and beginning the process of actively engaging with the federal government to reach out and coordinate the work. But the other one is recognizing that that we need to do some early identification and connection with the children as they come into the county and before they come into the county, if at all possible. A more active approach in dealing with, a proactive approach in dealing with the trauma of family members as they come in. And some recognition of that the reunification process does not always go as well as planned. And we're working to make sure that we provide support for the families and the children as they reunify with each other over time, that is going to take some time to settle in, and there may be some challenges that they will need support with.
Thank you for that. You anticipated my question on, they come in and they're placed with sponsors. Are those sponsors relatives, or is that sort of an institutional foster sort of setting? And how many of these kids, these 104, actually have relatives here? Do we know?
So memory serves, and I'm going to miss this number, that in the neighborhood of 60 to maybe 70% of them that are coming in, we know have family members and or sponsors who are friends or relations who agree to be their sponsor once they arrive here. So they come with those destinations in mind. There are a number of them we think that will need are looking for sponsors, and the federal government and their local partners are identifying sponsors for those children before they arrive here. So we'll be coordinating LIRS, Catholic Relief Services, for example, do a fair amount of work to coordinate and identify sponsors for youngsters before they arrive.
Got it. Thank you. If I can pivot to Dr. Stoddard and concerns about waste. Our partners at NBC had reports on CVS and Walgreens and some vaccines going to waste is the word that they used. Do we have evidence of that here? Are you concerned about the ability to get those vaccines out the door and into arms?
We haven't seen it at either the county sites or the mass vaccination sites at this point. We haven't had doses go to waste. I mean, as I said, I think during my briefing, we received, I think, at the mass vaccination site, 4,600 Pfizer doses last week. And I think we had, after Friday, we had, I think, 220 left over, and we'll utilize those first this week. And so we haven't had I mean, and obviously they're good for, like a month. So they're a week old at this point. So I don't expect that we haven't seen it at this point. Obviously, in 3 weeks or a month from now, I can't say that we won't see people not taking advantage of doses and doses sitting around, but we certainly have not seen that to this point. We're giving out what we receive every week. We have obviously a lot of second doses going on right now too, and we're seeing a pretty good uptake of those as well. We aren't seeing what the pharmacies are seeing. We're still able to get out. And in fact, in some cases, we're actually partnering with some of the grocery stores and other places to try and find opportunities for them to utilize vaccine that they may be struggling to get out.
Got it. And last question, not related to the topics we've talked about so far, but I'm curious for the council members, council president and vice president, police in schools, SROs, there was a coalition of student groups that said they're very unhappy with the way that the topic seems to be shifting and handled by the county executive. Where does that stand, and how are you addressing their concerns?
Kate, I think it's a bit of a moving target, but I think the task force that's set up is very committed to receiving feedback from all the students, and I think once the process begins and people take the time to hear from people, I know all of us are very committed to making sure that their voices are very much heard throughout the whole discussion moving forward.
And Councilmember Albornoz, do you have any thoughts on this?
Well, I'm familiar with most of the members of this task force, and I have a high degree of confidence that they are going to take into account the many very important voices to this very important discussion and provide a series of recommendations to the council that will operationalize and that will provide thinking beyond just the school resource officer issue to ensure that we have very tight and comprehensive programs and services, particularly in behavioral health, because we know that students are experiencing unprecedented challenges this past year. And so this group will provide a series of recommendations that expand and go beyond just the school resource officer issue to ensure the health and wellness and safety of all students and faculty and staff and everyone that's impacted by this discussion. So I look forward to their recommendations. That we know there's urgency so that we can have these recommendations in place. And if it's not done in time through this particular fiscal year's planning process, the county executive has gone on record as saying he will present a supplemental so that we can get the recommendations implemented before the beginning of the next school year.
Yeah.
Thank you. Thank you very much.
I think we all know there's a lot more to be done, Kate, and I think everybody needs to, if everybody takes a deep breath and lets the process play out, everybody's going to be heard.
Thank you.
Thank you, Kate. Our next question is from Milagros Melendez from El Tiempo Latino. Milagros?
Hi, how are you? Thank you for taking my questions. And I have questions regarding vaccine and regarding unaccompanied minors. Regarding vaccines, following the questions, well, can I do in Spanish for Vice President Albornoz?
Sí, ni un problema, Milagros.
Okay, bien. Probablemente lo voy a formular un poquito en inglés para the Washington Post have come out with a report that's saying that police officers, they are not having the vaccine. Y no es, entonces, que si los policías en general, en el 33% no están recibiendo las vacunas. Se han visto reportes aquí en el condado de Montgomery y hay unas sugerencias de hacerlos mandatorios para los health workers and also police officers. ¿Hay algo de eso aquí o no?
Buena pregunta, Milagros. Yo leí ese reporte también, que a nivel nacional es cierto que hay ciertas categorías, incluyendo policía, que por cualquier razón no están recibiendo la vacuna. No tengo los números aquí dentro del condado, así que le voy a preguntar al doctor Stoddard, al doctor Crowell, si tienen esos números o si no, te podemos conseguir esos números. So Milagros asked about the report that police officers nationally are not receiving vaccinations at the same rate as the general population. And that obviously presents concerns because as first responders who are not vaccinated, then that could put not just themselves, but the community at large at risk. Do we have any data or statistics at the local level of how many police officers have been vaccinated? And Dr. Stoddard and Dr. Kroll, I don't know if you have that info.
Yeah, I would appreciate if you have something to say about that.
Mm-hmm.
The most recent numbers that I've seen are actually much better, candidly, than I think we've seen nationally. I know I can get more specific numbers following, but I do believe they're in the area of 70%, 75%, which is not substantially different from our population. It's actually better than our current population rate, but it's around what we thought we would see from a population rate, given that there are some people who are very hesitant. The last 25% are very hesitant. So that's right around, I know it's around 75% for our fire rescue squad, our EMTs and the like, but I believe it's actually similarly pretty high with our law enforcement, but I'll have to confirm.
Yeah, what is the policy here? There are some experts that saying that they should obligate to do that for health workers and first responders having more than at least 85%, or are we okay with the 75%?
Well, I don't know how we define okay. We would prefer it to be higher. It's not as bad as we feared at some points that it might be. But there were obviously concerns amongst the population. I mean, they were one of the first to be offered the vaccine, and we just weren't sure what we'd see. And so obviously we would like it to be higher. We'd like to be higher across the board in all populations. But fortunately, we have not seen we've seen a precipitous drop in the number of quarantines and isolations that we've had to do for our first responders. And in almost all cases, there've been things that they've done in their personal lives that have warranted some issues, and not things that they've either brought to work or experienced while at work.
All right. There is a 25% of, hay una encuesta que dice que 25% de jóvenes no quieren ponerse la vacuna. Eso también lo estamos mirando en el condado de Montgomery, y cómo podemos contrarrestar eso.
En este momento, como vio el reporte Dr. Stoddard, los números son mejores aquí dentro de nuestro condado, pero como una categoría, sí es cierto que jóvenes, especialmente a nivel nacional, por cualquier razón, no están recibiendo la vacuna al mismo porcentaje que la población general. Lo que va a hacer el condado es trabajar juntos para aumentar la comunicación a jóvenes y trabajar con jóvenes para que ellos mismos pueden dar el mensaje de la importancia de la vacuna, porque como un gobierno podemos dar ese mensaje, pero los jóvenes ellos mismos que pueden practicar con sus amigos y también otros estudiantes dentro de los colegios, que son los mejores personas para dar esa información y ese mensaje. So just really quickly in English, Milagro asked about the percentage of youth that have reported for whatever reason reluctance to receive the vaccination. And as Dr. Stoddard reported, we don't have specific information on the disproportionality of who is and isn't receiving the vaccination or for what reason. But we are concerned nationally that the trend may hold here in Montgomery County as well, that for whatever reason, youth may be reluctant to receive the vaccination. And I mentioned the effort I mentioned in my initial remarks that we are working on a definitive communication plan and a marketing plan that is targeted to youth. Important to note that we are recruiting youth to help us with that marketing because government communication constructs are not the best way to reach our youth and youth themselves, as we've learned when address vaping issues and tobacco issues and other issues are often the best at providing communication among their peers. So we're going to be launching that soon.
Okay, and my last question regarding this is to reach out the Hispanic community. What is the budget that you have for Montgomery County to reach out this population? I'm working for El Tiempo Latino. My readers are Latino, so that's why it's so focused, the question.
No tengo información específicamente sobre el presupuesto, pero que sé que estamos usando fondos de parte de lo que recibimos del gobierno federal para hacer este trabajo importante, pero te podemos llamar de vuelta, Milagros, con más información sobre ese presupuesto. So she asked about how much is the line item for communication to these populations, and I don't have that information before me, but I indicated I would be following up to find out what is the line item to reach these populations, in particular youth. And I know Mr. Barry Hudson, the county's public information officer, is working on that budget right now.
Thank you so much. The questions are regarding unaccompanied children. I don't know if you already addressed that, Dr. Stoddard. You said last time that Montgomery County was going to meet with FEMA representative to address the situation of unaccompanied minors. What are the conclusions? What are the steps that you're going to take with FEMA regarding unaccompanied children?
Dr. Pearl's going to answer that because he was in the meeting too.
Okay, thank you, Dr. Stoddard.
Okay, both of you.
We met with FEMA to discuss the possibilities and ways in which we could reach out to unaccompanied minors in advance of them coming into the county, so that we could do some engagement with them, as well as to talk about alternatives and options for short-term residential capacity when they arrived here, before they were reunified with their family members. FEMA indicated that their focus in the moment was primarily on assisting the federal HHS in establishing transient facilities in other states to get the children off of the border into some other locations, so that they could be worked with by HHS and prepared and supported in getting to their final destination. Our hope was to be able to establish some smaller facilities, but that's not something that's in the cards for us with FEMA at present. So they do have partners with local partners that do that work. LIRS, I mentioned earlier, Catholic Relief Services, maybe some others as well, that are working to provide short-term local residential capacity for children coming into the counties, into the area. The other piece in terms of outreach to advanced outreach to youngsters as they were coming before they got here, the goal would be to catch up with them and connect with them. They've agreed to and asked us to work with HHS and in Office of Refugee Resettlement to reach out and provide contact information so that they can share that information with folks who are coming in to the county, and they can reach out to us at their discretion. There's some concern, understandably, from history of sharing the names and contact information of youngsters who are coming into the county with a government agency, out of concern of where that might go, or with even private providers. So they have a very limited capacity to do that at this point. We had a good conversation with folks at HHS and ACF last week about, as a follow-up to this conversation that you're mentioning with Dr. Stoddard. And the conversation was around the things that they can do in terms of putting folks in touch with us and making folks aware of the resources that are out there, and awareness of the need for some longer-term support for youth who are in transit and on their way to the county. So that's the best summary I can give you right now. Dr. Stoddard, is there anything else?
No.
Okay.
Well, thank you so much. When can we have some data? I understand that in 2014 there were 1,100 unaccompanied children, and you said that is 100 right now. But when do you think that we're going to have that data?
Lo que nos han indicado el gobierno federal es que están moviendo adelante con el proceso de que al principio fue un poquito difícil, así que anticipamos este verano vamos a tener un número mucho más fijo de cuántos jóvenes están aquí dentro del condado. So we did receive a message from our federal partners that they are working aggressively to catch up to the current situation, and they're confident that they will be able to report more substantial and solid numbers this summer.
All right, thank you so much for taking my questions. Thank you.
Thank you, Milagros. Our next question is from Luis Hernandez from Univision. Luis?
Muy buenas tardes, good afternoon. My question to VP Albornoz, it's a little bit similar to the previous questions in regards to the unaccompanied minors, but I wanted to see if you can focus on what was said on the Committee for HHS and Education and Culture last week in regards to being more proactive. Ahora en español, en la Junta del Comité del HHS y Educación y Cultura se hizo una mención de medidas para ser más proactivo en cuanto a la llegada de los menores no acompañados. Concejal Albornoz, si nos puede platicar un poquito de qué medidas se están anticipando para poder darle la bienvenida a estos jóvenes.
Bueno, trabajando en una alianza con el gobierno federal, queremos conseguir la información de contacto de estas familias que están recibiendo a estos jóvenes para indicarles cuáles servicios y programas tenemos aquí dentro del condado. Y también queremos formar una alianza dentro de los departamentos del gobierno que van a trabajar con estos jóvenes para que puedan recibir todos estos programas juntos, en vez de tener que ir a muchas diferentes áreas o explicar de nuevo en cada situación la situación de estos jóvenes, porque nosotros sabemos especialmente con el trauma que hemos visto en estos jóvenes que es bien importante que solo tienen que explicar una vez qué es lo que les ha pasado, porque cada vez que tienen que explicar causa trauma de nuevo. Así que esos son parte de los pasos que vamos a tomar moviendo adelante para apoyar a estos jóvenes. So what I mentioned was that we are working with our federal partners to identify these families and proactively reach out to them to let them know of the programs and services that are available to them here in Montgomery County. And through this interagency collaborative, ensure a more seamless transition of referrals. As Dr. Kroll mentioned, we know that these students face tremendous trauma, and every time they have to re-explain that trauma to a different government agency to provide a service, they re-go through that trauma. And so by forging a stronger partnership and alliance for a referral process, we want to minimize that, but also provide more seamless support.
And one more follow-up, Dr. Kroll mentioned this, if you can repeat it in Spanish, just in regards to assistance from FEMA and not being an option at the moment, and that you guys are working with Catholic Relief Services, and also that your federal partners will mention kind of a recap of the current numbers during summer. Si nos puede platicar un poquito de los números, por favor, de verano que se anticipan, y también la situación con FEMA.
Como dijo el doctor Krell, esperamos que este verano vamos a tener más información sobre los números fijos de cuántos jóvenes van a venir a nuestro área, pero anticipamos más o menos 3,000. Y eso es por los números que hemos visto a nivel nacional de más de 34,000 estudiantes que ya han entrado y más que están entrando. Y así que vamos a tener más información este verano.
Y en cuanto a los recursos de FEMA,
Sí, perdón, me olvidé, Luis. Así que FEMA nos ha indicado que en este momento no tienen información sobre recursos que van a dar a diferentes condados o áreas municipales que están trabajando en este tema, pero sí han indicado que van a aprobar fondos para que nos pueden ayudar con fondos encima de lo que ya tenemos aquí dentro del condado. Y esos fondos van a ser importantes porque nosotros sabemos que en la situación en que estamos en este momento con la pandemia, muchos recursos ya los estamos usando para luchar contra la pandemia. Así que va a ser importante recibir fondos encima de eso.
Thank you so much. Lo agradezco.
Thank you, Luis. We have a follow-up question from Kate Ryan at WTOP on the unaccompanied minors. Kate?
Yeah, just apologies here, but I want to understand where these children are in the process, what they're going through right now. Are they with their sponsors in the county, or are they waiting to get here? I'm trying to imagine, what their experience is. What do we know?
So the 104 that we know of have already been released to sponsors here in our community. But we also know that there's as much as a 2-month delay and lag in the information that our federal partners have been able to put together. So that number could be higher. And as Dr. Kroll indicated, that only represents the students that have been stopped at the border. That doesn't include the students that have been able to make it across and are not currently on anyone's radar screens at the federal level. So the number could be higher. But of the 104 that have been released to Montgomery County, all have been released to sponsors.
Got it. And again, in terms of their asylum process, do we know how long that might take for them? Again, having taught and knowing what teenagers go through, for example, living with the uncertainty of where is my case, what's going to happen to me. Do they have any idea of how long it might be before they can kind of breathe easy and know what their status is and be certain of that?
We unfortunately don't know. What we do know is that there's a significant backlog in the judicial process for students to go through that are seeking asylum. And so there is a lengthy amount of time before our federal immigration system is able to catch up to the backlog of cases from previous waves that have come forward, but we don't have a specific time frame.
Appreciate that. Thank you very much.
Thank you, Kate. Thanks to all the reporters who joined us today. Mr. Hucker, I'll toss it back to you. That wraps up all of our questions.
Thanks so much, Ms. Kennedy. Thank you, Dr. Kroll, Dr. Stoddard, Vice President Albornoz, and thanks to everybody for joining us. We hope to see you again tomorrow.
Thank you.
Have a great day. Thanks.